pharmacology abbreviations. So again, with medical terminology, we abbreviate a lot of things inside of our medical world. And so pharmacology abbreviations are some of the most common abbreviations that we see inside of our medical notes. Okay, pharmacology is the study of drugs and medications. We're going to look at some additional full words in a future unit. For today, we're going to focus on abbreviations associated with pharmacology, not so much the actual drugs themselves. So let's start with this first abbreviation. It is RX, and we usually pronounce it just RX. That is the abbreviation for prescription. I know it doesn't look exactly like the word prescription, so sometimes students mistake this one, but RX is the abbreviation for prescription. Okay, one of the most common places you're going to see abbreviations are in medication orders. So whether you are looking at a new patient intake, and that's a lot of professions, right? Medical assistants, CNAs, nurses of all sorts, physician's assistants, they may be showing you a medication that they have, and you have to be able to understand those abbreviations. Or if you're educating a patient and you need to explain to them what the doctor has ordered, we use a lot of abbreviations. For this, we're just going to look at some of our most frequently used ones so that you can really interpret a medication order or something on that bottle, and you will know exactly what that means. All right, one of the reasons we have particular abbreviations is really safety with medications. And so learning abbreviations appropriately for pharmacology impacts your patients. So really, when we have two different types of abbreviations, one is QD and one is QID. And you're thinking this is just really one letter difference, but it's a huge difference to your patient. If you pull out that word list, you're going to see that QID refers to 4 times a day, where QD refers to just once per day. If you mistakenly read QD and QID opposite, you're either over-medicating your patients or under-medicating your patients significantly. And so making sure that you truly understand the difference and sort of memorizing those slight differences in the different amounts of medications is extremely important when it comes to safety for your patients. Let's take a look at a couple of number-related prefixes. So some of these you are going to see the abbreviations for in just a moment, but you need to know the prefixes that they come from. So let's look at 1 through 4. So mono, M-O-N-O, is the prefix that refers to the number 1. Bi is the prefix that refers to the number 2. Tri is the prefix that refers to the number 3. And quad is the prefix that refers to the number 4. You're going to see a lot of this when it comes to medication abbreviations, so you should really know where they derive from. Okay, so now let's look at the abbreviations that go along with them. So QD refers to once a day. Okay, that is the Latin, and please don't ask me to pronounce that much Latin. But those 2 words that you see on your screen do refer to once per day. BID, right, that BI portion refers to that bi we just saw with the prefixes and refers to 2 times per day. TID, right, that T portion stands for the tri prefix, so that refers to 3 times a day. And QID with the I, that Q portion is in fact that quad, which refers to 4 times a day. So really understanding how much dosage you are giving your patient and how many times a day is critically important, right? Make sure that we're keeping our patients safe by memorizing these particular 4 abbreviations. Okay, let's look at a couple examples of an order that might be given. So amoxicillin is an antibiotic. You don't really have to know that for this particular section of medical terminology, but it is often given 500 milligrams BID. Given the conversation we just had, how often are you giving this 500 milligrams to your patient? Okay, if you need to go back, review, rewind the video, please feel free as you're answering these questions. Hopefully this is an easy one. So that is 500 milligrams. It's being given 2 times a day or twice a day. So it's up to 1,000 milligrams. So understanding that BID that's going to be written by the physician is incredibly important because we need to give this medication 2 times per day. Okay, let's take a look at some abbreviation related to numbers and numbers related to medications. So they all have the letters Q and H in them. And Q and H refers to being given every hour. The next three are just going to see a number inserted between the Q and the H. And this helps to change how many hours we give it. Just the Q and the H alone is given every hour. But if you see Q2H, you are to give it every 2 hours. Q4H is to be given every 4 hours. And Q8H is to be given every 8 hours. Okay, the number in the middle really doesn't matter. It's really understanding that no matter what number is between the Q and the H, when it references medications, okay, that is how you spread out your dosages, every whatever that number is, and then hours. So one other conversation we need to have is different routes. Okay, so giving different routes of medications refers to the way we're delivering the medication. So let's take a look at a couple examples. So medication can be given as an injection. You can give it orally, which means by mouth. So please pay attention to what the doctor writes there in terms of how that medication is to be given. Let's take a look at a few abbreviations that are associated with a different route. So NPO means to give nothing by mouth. So these are for patients who might be pre-surgical, maybe have to have a procedure done. We don't like a lot of food in their stomachs. And so they will just have on their chart written NPO, which means to give no food or nothing by mouth if we're being very particular. On the flip side, PO by itself means to give it by mouth. So just really make sure that you're reading NPO versus PO because one is to give something through the mouth and one is to give nothing through the mouth. IM stands for intramuscular. So this would be an injection straight into the muscle. And if something is given through IM, this will be a shot for the patient. An IV most people are familiar with. This stands for intravenously. And this is generally where they stick this in your arm, right at that elbow area on the inside. We call that the cubital region. And, we give a lot of medications this way. You see this very commonly. And then we have SQ or SC. And really, I've seen it both ways. Some texts have it different ways. So if you see one of these, it refers to subcutaneously or underneath the surface of the skin. This is also an injection. Unlike intramuscular, a muscle is much deeper. A sub-Q or subcutaneous injection would be a very shallow surface skin injection. All right, let's take a look at some additional abbreviations. All right, AC means to give a medication before a meal. So it's usually referring to more on an empty stomach, okay, when you see the letters AC, although strictly it means before a meal. PC means to be given after a meal. And it really doesn't have to be after the food, but it really just kind of refers to the fact that it should be taken with some sort of food. And there are different medications that work differently, so just make sure that you can describe to your patient if it's AC that really it should not be on a full stomach. It should be empty stomach before you eat, and PC should be with food or just after eating. A PRN medication means as needed. So the standing order might be Q2H or PRN, meaning every 2 hours or if the patient feels they need it. And so that really refers to any time that they need this medication, it can be prescribed or taken. OTC is a common abbreviation. This one is usually all 3 letters capitalized. That refers to over the counter, and these are any drugs you can buy in the drugstore. They do differ from country to country, so medications you might get in the US versus Europe are going to vary a little bit. But anything you don't need a prescription for is considered OTC. ml refers to a milliliter, which is a unit of measurement. It's an extremely small unit of measurement. And a lot of medications are dosed as milliliters. And so this will refer to the amount of a medication that you're giving to your patient. And then TSP refers to a teaspoon, and TBSP, generally with that capital T, refers to a tablespoon. Hopefully you know from cooking that a teaspoon is much smaller than a tablespoon, so please make sure that you go ahead and pay attention to those things.